Tell him to hit the bottom right.
Dr. Steve, I think you're on mute. Well, he's got a couple minutes. He's probably getting.
Yeah, there we go. Okay.
Oh, you can hear us?
Yep.
Awesome,
Great.
awesome. How's it going?
Good. How are you?
Good. Yeah, thanks for coming back on the show. We're
Yeah, of course.
gonna hit record here, and then we'll jump right into it if you're ready.
Okay, I'm almost ready.
Yeah, take your time.
Yeah, okay.
We got.
Now what the hell? We'll just deal with it.
All right, I'm gonna start recording here. All right, Dr. Steve, welcome.
Hello, my friends.
Yes,
Hello.
welcome back. I think this is our third interview with you.
Is it?
Yeah.
It is.
Okay. Well, good. No, it's great to be back. Thanks for having me.
Yeah. So for all those who don't know, Dr. Steve is a real doctor. He's also the host of his own show called Weird Medicine on Sirius XM. Is that how you say that? Sirius?
Yeah, Sirius XM, like the star, because that's why it's the dog logo, because Sirius is the dog star, right?
Oh, okay.
And then, yeah, and I started on XM, so I always thought the Sirius thing was kind of dumb, but now that's they're my boss, so I think they're wonderful. But the merger between Sirius satellite radio and XM, well, it doesn't matter. That's old news. But anyway, that's where the name came from. And also I have a podcast as well on wherever you find podcasts, Stitcher, iTunes, that kind of stuff.
And what's the podcast called?
It's called Weird Medicine, strangely enough.
Okay.
That's convenient.
Yeah,
It's Weird Medicine : the podcast. But,
AAAFP.
yeah, during COVID-19, we've been simulcasting a lot of stuff because, when we talk COVID stuff, if it's going to be of interest to the Sirius XM people, it's going to be of interest to the podcast folks. But very soon, the podcast and the Sirius XM show will diverge again.
And have you been focusing a lot on COVID? I'm assuming.
Well, it's a medical show, and I'm like, when Al Roker gets all excited, it's when there's a big ass hurricane coming, and then he can step forward and he's the expert and all that stuff. And unfortunately, since I have a medical show, there's been little else to talk about,
Right.
Since February.
Yeah, we were gonna bring it up. We got a couple questions in regards.
Yeah, sure.
To it, but I feel like it's been talked about so much that it might be just boring.
There's still a lot of stuff for people to learn, though, because there's a lot of disinformation out there as well.
Yes.
So I don't mind at all. Matter of fact, I'm in the vaccine trial for Pfizer.
Are you really? Cool.
Yep. Yeah, I got the vaccine 3-4 weeks ago, and it's a double-blind placebo-controlled study, which means that neither the patient nor the person giving the shot knows whether it had vaccine or saline in it. But they made the mistake of telling me that the placebo was actually saline, salt solution. So when I got arm pain that lasted for 2 days and muscle aches and pains in low grade, elevated temperature, I was pretty sure I actually got the vaccine. So.
Wow.
So have you stopped wearing a mask then?
No, because I really don't know, but I'll tell you what, I'm going to find out tomorrow, because my primary care provider, I said, just order me a COVID-19 antibody. And see, that'll unblind the study for me, right? Because if I have antibodies and I haven't had COVID-19, I'm pretty sure I didn't have an asymptomatic COVID-19, although I can't be 100% sure. Then, then I got vaccine. So
tell us where we're at with the vaccines right now. Like,
they're ready to go. They're literally ready to go. So when you do a vaccine trial, you got to do it in 4 phases. So the first phase, you give it to like 40, 50, 100 people and make sure that when you give it to them, it doesn't immediately kill them, right? And then you do phase 2, which is a larger study, could be 300 to 1,000, maybe a couple thousand people, where you're looking, in this case, are they producing antibodies against the virus? You can't really tell yet that it's preventing people from getting the virus because the numbers are too small. I mean, even now we got 8 million known cases. We'll divide that by 350 million people, and the percentage is still way low. So, when you're only treating 300 people, you're not going to get those robust numbers to tell you it's preventing infection, but you can retest them and see if they're having antibodies produced. So that's phase 2. Then phase 3 is what we're in now, where you treat 30,000, 40,000 people. And now you can start to tease out rare adverse events like Guillain-Barré syndrome, which is that thing that sometimes comes with influenza vaccine, where you get paralyzed starting with the feet and then the knees and then the hips. That's why they called it ascending neuritis. But Guillain-Barré syndrome is a rare complication, but it could happen. And other things like the Oxford vaccine, they had to halt their trial just for a few days because somebody got this thing called transverse myelitis, which is an inflammation of the spinal column. And they determined it probably wasn't from the vaccine, because that sometimes it'll just happen. And, when you've got 30, 40,000 people, there will be some adverse events that really aren't related to the vaccine, right? Because you got 40,000 people, some of them are going to die, someone's going to have a heart attack, et cetera. So they proceeded. So anyway, that's phase 3, and that's where we are right now. Pfizer, really, if they just had a little bit more data, could have gotten this out in mid-October. They're going to go for mid-November to apply for FDA approval. And at that point, we should be able to see all the data. And
we need to convince people to actually take this thing. Like, you know what I mean? There's a group of people that
well, and that's the thing. I think what Pfizer could have done, and I would have volunteered for this, is a challenge trial. Challenge trial is a little different than a population trial, where, what we're doing now is you vaccinate 40,000 people, and then you see if in that 40,000 people that a 40,000 match controls or your placebo arm didn't, if the treatment arm got COVID-19 at a statistically significant rate that was lower than the treatment arm, right? I mean, and then the placebo arm. But there's another way to do it. You give me the vaccine, you have me come back 2 weeks later, and then you squirt COVID-19 viruses, SARS-CoV-2, up my nose, and then see if I get it. If I don't get it, then it works. And then they could have had this vaccine out in June if they had done challenge trials, but there are ethical concerns about that when you've got a deadly virus. What if we kill people doing this? So I would have volunteered for that, because I'm elderly now. I just turned 65 this year, and it's like, if I die, who cares? So, I would have stepped forward and done it, so you guys didn't have to, but
very heroic.
Yeah, whatever. Well, I wasn't offered the chance, so it's easy to say, but I would have done it. But I did step up and do the actual the regular trial, because I just thought it was the right thing to do.
What would you say, like, the top 3, myths surrounding, misinformation around COVID are, just misconceptions?
Oh, well, it's just, okay. So, and they come from the difference between case mortality and infection mortality. Okay, so let's talk about that just for a second, and I'll tell you the two competing myths.
Wait, so case mortality versus infection what's the difference?
Right. Yeah, that's okay. So let me tell you. So let's say you have a virus, and 1,000 people get infected, but only 100 people actually have symptoms, right? And out of that 1,000, 5 die. So the 100 people get symptoms and 5 of them die. So that's a 5% case mortality. But when you look at the infection mortality, 1,000 people were infected and 5 died. Okay, so you have to take into account all the infections that are really hard to take into account, which is asymptomatic people or people that had it and didn't report it, that kind of stuff. And when you look at those two numbers, they're wildly different, right? The infection mortality may be like 0.5, but the case mortality could be between 1 and 3. And even at 0.5, it's still 5 times more than influenza, which is right around 0.1. And so people who want to say that this is not a dangerous thing that we're doing, we're being stupid by shutting down our economy, which I don't disagree with on a certain level. They will use the infection mortality rate. And then the people are going, no, this is a dangerous virus. You know, the government isn't doing enough. They'll use the case fatality model. And that's where and the truth is somewhere you have to combine all of this and look at, you know, who is this thing killing? Well, my mother-in-law, here, a great example. She's built like a basketball on top of a bigger basketball, you know, big spherical head and a big giant spherical body, right? And she has rheumatoid arthritis and she's on, you know, biologics, or her immune system is suppressed. She got COVID-19. It just sailed right through it, you know?
How old is she?
72.
Okay.
So around the same age as the president of the United States, who also sailed right through.
If your mother-in-law is only 7 years older than you.
Yeah, well, it's because my wife is 20 years younger than me.
Oh,
so I'll give myself one of these. Wait a minute.
So, Dr. Steve, I know you mentioned you don't think shutting down.
Oh, sorry.
Oh, no, you're good. You mentioned you don't think shutting down the economy is the right approach, but what do you think we can be doing now, like as a federal government, you know, even local governments, that we're not doing?
Okay, so like my mother-in-law and the president of the United States sailing through this, those are anecdotal. That's anecdotal evidence, right? So you got to look at the aggregate evidence. And the people who are at the highest risk are people above 60. And the really highest risk are people above 80. So protect them. You know, when I don't go, I'm 65, I'm in great health otherwise, but I don't go to concerts and I don't go to places where there's a lot of people. I don't go to my kid's football game, you know, because the one kid in that marching band who's got COVID-19, who's just blowing through the baritone and just spewing virus out to everybody below them, could be a problem. So I don't go to that. But, you know, my quality of life is okay. I have Netflix and those kinds of things. I still go to work. I get exposed to COVID-19 every day, but I'm not going to get it at the hospital, you know, because we're fully protected there. So I think we protect the people that need to be protected. We use some common sense. Social distancing is fine, but don't just shut everything down. I mean, my friends in Manhattan are, you know, they had 0 deaths. Let me just look. I'm looking at covid.stoutlabs.com. And let's just look at New York real quick. covid.stoutlabs.com is a friend of mine, Daniel Stout, who runs Stout Labs. And he has created the greatest site for just graphing and looking at the numbers for all these different things. And so I'm going to look at new deaths in New York. And it was 0 yesterday. Okay. So I know we can't have just 0 tolerance. If we want to have 0 tolerance, what we should do is put everybody in a bubble like that Flaming Lips concert and put everybody in a bubble for 21 days. This thing would be over, but we would be over too. You know, that's the thing. So what we want to do is decrease, you know, mitigate the risk. So social distance in restaurants. People need to wear their effing masks to, you know, because if they're asymptomatic or if they're just mildly symptomatic, that's going to protect other people from them. The people not wearing masks, what they don't realize is that you're not wearing the mask so that you don't get it. You're wearing it so that you're not giving it to other people. And, but then open stuff up. You know, my kids are in school. I live in Tennessee, so maybe we're a little crazy in Tennessee, but my kids are in school. But the second that a teacher gets it, then they shut it back down again. But at least they're having some experience, you know, back in school.
In Colorado.
With
Yeah.
schools in Colorado.
Yeah. So I feel, can you imagine that your dream was to open a movie theater and you just, your whole life, you've been interested in movies, you want to bring this and you got all these cool ideas and then this shit happens. I just went to the movie theater. I didn't go in, but they had they've got 12 theaters. They had 11 movies that came out 2 years ago, and then they had Tenet. That's it.
Really? So, so you're pretty open in Tennessee now. I don't think our movie theaters are open.
I think they are with limited capacity.
Well, yeah, that's it. They're with limited capacity. That's fine.
Yeah.
If you can ride in an airplane or go to an airline terminal, and there have not been known giant outbreaks from that, then you can have a movie theater that's open. Every other seat's open or whatever. You can do that.
Yeah.
But anyway, that's protect the vulnerable. Otherwise, open up. And let's get a damn vaccine. Let's accelerate things like favipiravir. You and I talked about that last time, I think. That's that Japanese drug that should have come out in June, and it's been held up. I don't know why. I better not find out it was for political reasons. But it's a pill that you can take just like you would take Tamiflu, for example.
Oh, okay.
And you get it, you go to the doctor, they give you a prescription, you go isolate yourself for 10 days and then, take the pill, and you don't go to the hospital. You don't end up on the vent. If you do go to the hospital, if you do end up on the vent, you don't die. And that would be the panacea that we're really looking for, because if that thing is effective enough, we could really end all of this tomorrow.
So what are some of the other myths? Did any pop out? Because I know there's insane shit spreading around.
Yeah. Well, the airborne thing, it's not untrue. It's factual, but not truthful to say, oh, this is an airborne vaccine. So
really? Are you kidding?
Yeah. Yeah. Well, I mean, as far as small as aerosols and stuff, it can be under certain circumstances. So, and the myth that, oh, well, we need to be 12 feet apart instead of 6. All of these things are factual, but they're not really true. So, for example, if there's a load of viral particles that I expel with a cough at 1 foot, right?
Mm-hmm.
If you go to 10 feet, it's the square of the distance. So it'll be 100-fold less at 10 feet. And so 6 feet is one of those things that we can pull off, and it's not perfect.
Right.
But it will decrease transmission to the point where we can begin to go back to normal because of this number called the R sub T. So let's talk about that just for a second. So there are two numbers that talk about transmissibility. One is R sub 0, and that R sub 0, what was Sub-Zero's finishing move in what was it?
Mortal Kombat.
Yeah, in Mortal Kombat, right? So there's a joke there somewhere. But anyway, R sub 0, finish him, is would be the number of people that one person could transmit if they were in the middle of a population that were completely vulnerable. Okay, so that's your patient 0, for example. How many people will they transmit this to? And for COVID-19, the number is approximately 2.4. Now, to contrast that, the number for measles is 12.
And
so
how
12.
long does it take? Because I've heard that you can sit in a room with someone, with 10 people, one person has it.
I heard
and it takes like 3 hours to get it.
I heard 15 minutes.
Yeah. So 15 minutes is the definition for exposure. And there's sort of, it's not really legal, but it's a medical definition that we use to determine whether we need to test somebody or isolate somebody. So if you've been cumulative 15 minutes in close contact within 6 feet of somebody for 15 minutes, then you're considered exposed if you were not protected with personal protective equipment. That's all that is. So look, so the R sub 0 is 2.4. Now the R sub T is the real world. What's the average of people in the real world? How many people they're transmitting to? And you can go to a website called rt.live, and that will show you every state. Yeah, rt.live. Let me do that right now. So
why did porn just pop up? Just kidding.
Right. Okay, so you can see that every state except for 3 right now, because we're going through another wave of this virus, has an R sub T of greater than 1. So an R sub T of 1 means that 1,000 people will give it to 1,000 people, will give it to 1,000 people, will give it to 1,000 people. So it's the same number every time. So if you graph that, it would be a straight line going from the lower left to the upper right, right?
You guys are doing better in Tennessee than Colorado. I'm looking at it.
So,
right now.
Dr. Steve, when you say a second wave, like,
Or third wave. We're going through a subsequent wave.
so what are we in for the winter? Is it going to get just as bad as it was, or is it already run through our population to the point where we don't have to worry about
Well, that's interesting, isn't it? Well, we were talking about, let me finish that topic and then I'll absolutely come back to that. But because there's a reason why I'm showing you this R sub T. So, but look at that. The highest R sub T on there is what? In New Jersey at 1.3, right?
Mhm.
So now 2 is where you see this geometric increase where you get 2 infects 4, infects 8, infects 16, infects 32. So all we have to do is get the R sub T below 1, and then the virus starts to decline, because then 1,000 people will infect, let's say if it was 0.9, 1,000 people would infect 900, which would infect 810, which would infect 720. So all of these things, wearing masks, will you give me that mask wearing will decrease transmission by only 10%? If you will give me that, then that would, let's see, that would get us all of the states from Kentucky below. That would be half the country would have an R sub T of less than 1. Do you see that?
Yeah.
So and then social distancing may be decreased by another 40%, et cetera, et cetera. So we're not looking for zero tolerance. We're looking to decrease transmission to the point where R sub T is less than 1. And then the virus will go away on its own at that point.
Interesting. And
Yeah.
Hans just brought up an interesting point too, that Florida has one of the lowest
Which you
ratings.
wouldn't think.
Yep.
And aren't they
Yep.
case wise like the worst right now?
Yeah, well, they may be. And remember, cases, that's when this argument comes up about testing too. So you have to look at everything. Are they truly cases? Are they people that are symptomatic, or are they just positive diagnoses?
Right.
So you have to tease all that stuff apart. And there's an algorithm for figuring this stuff out. But yeah, right now, Florida's R sub T. And that could be a function that because they're going through a spike, that they've shut some stuff down and people are being more careful as well.
Interesting.
And it's like the end of summer too. So.
Yeah. Now, at one point, we had all of these, 4/5 of the country was in the green.
Oh, really?
So, yeah. So then you asked, well, where are we going? Hell, we don't know. We don't know still to this day the asymptomatic rate. If it's high enough, because the R sub 0 is 2.4, you can calculate how many people have to be immune for us to get herd immunity. And the number is about 55%.
And why is there such a huge why is there such a large number of people with no symptoms? Isn't that like weird?
Yeah. Okay. Well, yes and no. Think about other coronaviruses. Other coronaviruses cause common cold. So we don't know how many people actually get those. We just know, hey, I got a cold. Nobody else in my house got the cold, but it was, they may have had it and been asymptomatic. So coronaviruses have a high asymptomatic rate. And this particular coronavirus will probably just join this pantheon of other coronaviruses in the next generation and just be a common cold virus.
So we're not,
because you'll notice little kids don't get sick with this.
Right. Yeah. Right. So this is something that's going to fade away and we're going to go back to normal life, because I've heard.
Absolutely. Eventually.
Because people are saying, oh, we're never going to be able to live like we did ever again.
Well, that's foolish.
Exactly. Yeah. Okay.
The pandemic of 1918 killed 1 to 3% of the world's population, which doesn't sound like a lot until you run the numbers. It was a huge number of people. Right. And it only affected 10% of people. We're not even close to that with this one yet. that we're trying not to get there.
Yeah.
You know, that means 90% of people during that pandemic didn't get it.
Yeah.
Right. The vast majority of people didn't get it, but the 10% that did, it sucked. And, 10% of those died.
So we have, I want to make sure we get to some of our listeners' questions because we do have a few more.
Yeah. No, that's fine.
And just so you don't bore, like, COVID's just everywhere. People need some diversity.
Well,
not back to it. I just want to touch on some because we got a good amount of questions.
Yeah.
Okay.
About,
well, I want to talk about the bestiality one.
You want to go there? All right.
Yes.
Like, what are some, like, and that kind of relates to COVID because they say that a bat gave it, some guy eating a bat, which is.
Yeah, do you believe?
Yeah, well, South Park had a different theory of that. If you saw the pandemic,
I haven't seen it.
Oh, you need to watch it. You absolutely need to watch it. In that one, it was either one of the kids' dads actually had intercourse with a bat in a brothel in Wuhan. That's what happened.
Yeah. So, I mean,
and they actually showed it, which was pretty disturbing.
Fucking South Park. I haven't watched that so long. Yeah, we'll watch that.
We're getting a snowstorm in Colorado today. We got probably like 2 or 3 inches on the ground.
Yeah.
Oh my God, it's 80 degrees here. I was working out in my garden before I
the one COVID question I did want to ask, and maybe we can do it after the bestiality, but in regards to like a lot of legit scientists, I don't know if they're legit, but scientists are saying that this was created in a lab. So maybe we can touch back on that later.
Well, no, that's okay. Let's wrap up the COVID thing. It's fine. The spike protein that this coronavirus has a mutation on it that is counterintuitive. In other words, when you look at the sequence, it looks like there's no way that it would attach to a human ACE inhibitor, and yet it does. So this is one of those things that argues against that, and they've sequenced the DNA. And, the only way you could say for sure is if somebody coded a message in the DNA, which you can do, but they haven't found anything like that. I do believe that this thing was probably being studied in a lab. I doubt that it was created in a lab, but we may never know the answer to that. Now, you asked me about where, are we going to have to live with this forever? Yes, this virus we will probably have to live with forever, but my hypothesis, and I haven't heard anybody else talking about this or proposing this, is that all the coronaviruses that are currently in the population that cause common colds right now, and they kill about 10,000 people in this country every year. We just don't test for it. By God, we will now, but we never did before. That all of these viruses started as a global novel coronavirus pandemic, killing a certain percentage of adults that were exposed to them, but leaving the kids alone. Then those kids grow up, and when the virus circles around again, they're already immune to it. So all of the adults that get common colds from coronavirus were likely exposed to these coronaviruses when they were kids. And so that same pattern, it's just that right now, we have adults that have never been exposed to this particular coronavirus, so they didn't have that immunity that they built up when they were kids, and that's why it's killing some people. And I believe that this one will circle around, and a generation from now, this will be the 6th coronavirus that just circulates, causing common colds, which means I really feel like we need to declare war on coronaviruses altogether to eradicate these efforts from the earth. We did it with smallpox. This would be a lot harder. It's going to require a moon launch or Manhattan Project style project. But let's hit the coronaviruses first, then hit all the rest of the human viruses, because really enough is enough. Do we ever want to go through this again, even if it's going to be 100 years from now? Yeah. This is bullshit. Okay. And the viruses they're just these micro machines that just reproduce to no end. There's no purpose to it. So F them, we need to declare war on them. We need to eradicate them, and we need a virus-free future.
We're actually live right now, and we're getting some questions coming in. Someone asked, what's the deal with the O-type blood and COVID?
Yeah. Okay.
Thing?
It's for real. It's for real. But it's just an association. So if you have type O, you're about 20% less likely to be in a database that said, yes, you had COVID-19. And if you have type A, you're about 20% more likely.
Really?
They don't know why.
Huh.
And it's such a small number that you won't ever be able to say, oh, well, this guy had type A and that's why he got COVID and died. You will never be able to do that, but it's just an association. But it has been verified, through population studies.
Well, that's interesting because I have type O, and I think most of my
I do too.
Yeah, I'm also.
Yeah, there you go. Well, we'll be fine then, right?
I guess so.
It doesn't work that way, but we're 20% less likely to be in a database down the road that said that we got it. That's basically all you can say about it.
Right.
So 80% more likely to be.
So you're
Yeah, never mind.
you're looking for like a massive global effort to make sure that nothing like this happens again.
Yes. Yeah, it's worth it. The money, the stuff we would learn from that too, just like the space program, so much technology came out of that. The biologic knowledge that we would get from a process like that, and the improvement in quality of life for humans across the globe from now until the sun turns into a red giant would be unmeasurable.
Interesting. Well, hopefully we fucking get it together.
Yeah.
Yeah.
But anyway, let's move back to the bestiality because
yes, please do.
Question. So I think the question was like, what STDs can you get from bestiality? But where do you want to take it?
Yeah, like I guess like what other diseases are there, right?
Yeah. Absolutely. Well, okay.
There's a racist rumor, back in the day that like a black man in Africa fucked a monkey, and that's
oh, for God's sake.
That isn't true, but I don't think. But like that was I feel like that stems. There's some truth maybe.
Yeah, you're talking about HIV, or you're talking about Ebola? Because
HIV, I heard that before. That was like a thing.
There is a simian HTLV. Well, it's not HTLV, but an HIV type virus, and so presumably there was some crossover, but there a lot of people eat bush meat and stuff, and there's no way to know. We'll never know where it came from. Same thing, Ebola, where they still can't find the reservoir. If they found out it was just a certain type of snake or something in Africa, you just kill them or figure out a way to vaccinate them like we do with foxes. We just throw out rabies vaccine food into the woods and they eat it and they get less rabies.
Is Ebola still an issue in Africa? Or?
Well, yeah, from time to time there will be an outbreak, and
I'm scared of that one. That one was fucking scary.
Yeah, the good news about Ebola is that it's hard for it to go wide because it's so deadly. So what we really need to be afraid of is a version of Ebola that doesn't kill quite as many people, but also is airborne transmission. Now that will F us up big time, which is another reason why preemptively we need to just go after these viruses.
Yeah.
But anyway,
fucking animals doesn't help.
No, so so when you get a disease from an animal, it's called a zoonosis or a zoonotic disease, and those are diseases of animals that can be transmitted from animals to humans. So for the most common version of that would be somebody's got a lizard and they get salmonella from it, because a lot of lizards will carry salmonella.
Having sex with a lizard?
No. Just holding them, or letting them run away. No, that would be. I don't know how the hell you would do that.
If you're a female and it's like a big one, it's got a big tail, like a fat iguana.
I guess. Well, you would know more about that than I would. So, but there's about two.
Like a mental disorder where you're just naturally attracted to animals, or is that a thing?
I think it's more of an opportunity thing, and then you just kind of get used to it. Maybe, I don't know.
Brucellosis is on the list, and I studied abroad in Tanzania with the Maasai tribe. They brought us a goat as a farewell present, and I stuck my hand in the goat and drank the blood out of it.
Oh, Jesus!
And at the time, my professor said this will be a rich anthropological experience. You get brucellosis.
What's brucellosis?
Yeah. Yeah, it's just that's brucellosis. God, I haven't seen a case of brucellosis in ages. It's a bacterial infection that you can get from animals, and people usually are infected by either eating raw or like unpasteurized dairy products. So, like if you drank the milk out of that, it was infected with brucellosis. And occasionally you can get it to spread through the air too. So it just causes, a respiratory illness. You get fever, chills, loss of appetite, that kind of stuff. Joint pain is a big thing.
Man, we just continue to get COVID questions. Everyone.
Okay, well let's talk about this. So the big ones are leptospirosis. That's any contact with sexual organs of dogs, cattle, pigs, horses, and sheep, and leptospirosis. So it causes meningitis, and that'll kill about 10% of people who get it. And then there's echinococcosis, which is a parasitic worm. And you get that from the feces of dogs, cats, and sheep. And these worms, if you get them in you, cause cysts in the lungs, liver, brain, spleen, heart, and kidneys, and that can kill you. And then, of course, the most serious zoonosis is rabies. So if you're effing a rabid horse, then you could get it. But the one that terrifies me the worst is that sexual contact with animals is a risk factor for penile cancer. And they did, listen to this, this will kill you. 118 penile cancer patients were studied. 44.9% of them had reported sexual contact with animals.
Holy shit.
What
the fuck?
Wait,
yeah.
So what's the difference between penile cancer and like HPV?
Like prostate cancer.
Well, penile cancer is just cancer of the penis. So now this was, where was this study? This was in Journal of Sexual Medicine. And now HPV can cause cancer of the penis, but that would be the other, 50x%.
So if you have sex with an animal, there's a good chance you're going to get penile cancer. Why is that? Just because of weird?
Yeah, who knows?
Yeah.
It doesn't matter. Why doesn't matter. Yeah. I'm trying to figure out where these guys were that did this study. I'm looking to see if I can see what university, but their names are I don't know. I don't know where that was. It might have been in.
Have you ever had a patient who fucked an animal?
Not that ever admitted it to me.
Yeah, that's a hard thing to admit.
Well, that old joke though, where the judge gets the guy up and he says, "Well, sir, you've been charged with having intercourse with sheep, horses, pigs, goats, and dogs. How do you plead?" And the guy goes, "Goats." So, all right. Anyway.
What was that? Oh, sound.
That was my boo sound effect.
That's a good joke.
I want to see if I could get you a little off-topic joke. Do you know what Murphy's Law is?
I mean, I know the classical definition of Murphy's Law.
Yeah, anything that can go wrong will go.
Correct.
How about Moore's Law?
Sure, that every couple of years the processing power doubles.
Exactly. And then do you know Cole's Law?
Yes, you make it with mayonnaise and cabbage. Yes, thank you. That's a good one, though. I'm going to remember that.
So the moral of the story is,
I was just too smart for you on that one.
Yeah,
and I'm from the South, so when you say coleslaw, it's like, well, coleslaw, of course I know what that is.
I get most people in Colorado with it.
Yeah, of course.
I'm in the mood for some coleslaw.
We should make some after this.
So here's a question. Someone just said, I thought stomach acid destroyed the virus before infections. I don't really know what that means.
No, he's referring to like, how could you get COVID from eating an animal if the stomach acid destroys the infection?
Okay. Well, we didn't really say you could get COVID from eating an animal, but I think they were talking about that brucellosis or whatever. Yeah, you know what? Stomach acid doesn't kill all bacteria. Some of them are protected against it. For example, salmonella. If you eat chicken that's raw and it has salmonella on it, you're ingesting those bacteria and they survive plenty long enough in the stomach acid to cause all kinds of problems, and make it to your colon and start excreting inflammatory factors and stuff, and then it gives you raging diarrhea. And really, if you inject the wrong version of salmonella, you can get typhoid fever too. And then Shigella is another one, and then brucellosis is another one. Yeah, stomach acid is a defense, but it's not an absolute defense. And in this country, particularly, so many people are on things like PPIs or H2 blockers. The Pepsids and the Previcids and Prilosec and those kinds of things that. Our stomach acid is less of a defense than it used to be.
Interesting. Wait, Dr. Steve, you know that random chick who tweeted at you about having orgasms on her dirt road, which I thought was funny? That made me think of something that happened to Hans and I recently. We were on a rafting trip, and this girl went and took a pee over some rocks and said she had a full-blown orgasm. What? I don't even know.
We were like rafting on the Colorado River, like drinking, but she said she peed and had an orgasm.
Yeah.
Or was she hanging off the side of the boat?
I don't know what my.
Oh, I bet that's what it was.
I guess my question is like, what? I don't fucking know. But
those are called Coregasms.
Coregasms?
Yeah, Coregasms. So
Orgasms?
It's an exercise-induced orgasm, and. So any orgasm prompted by physical activity that's non-sexual is we'll call it a coregasm.
What's that?
You're just, if it doesn't happen to dudes, but it can. 1 in 12 men have had an exercise-induced orgasm. I almost don't believe them, but 1 in 10 women will. And basically they're just jostling around the nerves that otherwise would respond to sexual stimulation when you jostle them around enough. That it's a spinal reflex. That's all it is.
Really?
And if you
I was gonna say, when I was like 6 or 7, I had a full-blown before I even knew what an orgasm was. I had a full-blown orgasm while I was swimming once. Is that what you're talking about?
Wow, that's really interesting. Yeah, you might be the 1 in 12.
It was. I didn't know what it was.
I'm going to start the first hashtag for Coregasm ever on Twitter right now.
Okay, fair enough.
So you think this girl had a coregasm? Interesting.
Yes.
Now we know.
Oh, yeah. No, if she was for real going up and down on a bumpy road, women there are certain women that can have orgasms from that kind of stimulation. What I would be interested in doing a study where you get someone that can have exercise-induced orgasms. Are they also easy to orgasm during sexual activity?
Would you perform this study?
Absolutely, yes. Yeah, I mean, there's actually clinical ways that you can induce orgasms that are perfectly clinically okay that will pass an institutional review board's review. Well, using certain stimulators and stuff. It's like, okay, if you go to my website and just put in female ejaculation, I talked about a study. You don't have to do it now. I'm just telling your listeners.
No, this is fascinating, though.
Where they put in basically a vibrator and induced orgasm with it. At the same time, they put an ultrasound probe over the woman's bladder. And what they saw was an exponential increase in fluid collecting in the bladder that then was expelled. And they called that, coital incontinence. So there's two things with female and
after sex.
Yeah, there's female ejaculation and there's coital incontinence. So some women that squirt, quote unquote, are actually having this thing called coital incontinence, where their bladder is filling up with this dilute fluid. Now, it's technically urine because it's coming from the kidneys. Yeah, okay. I said fluid.
And shower after you get squirted on?
What's that?
Should you take a shower after you get squirted on?
Probably.
Should you? No, I mean, you don't have to. It's so you'll have guys that say, well, I'm down there, eaten at the Y or whatever, and this happens, and they'll swear it's not piss. They say it's not piss. It doesn't taste like piss. Like, well, they would know, but it is different because it is highly dilute urine. It's just basically free water. And this is a phenomenon that is solely involved in sexual activity. So it's a different thing than just when people say, well, squirting is just piss. Yeah, if you define urine as it's fluid that came from the kidneys and went to the bladder and then came out the urethra, yes, it's that 50% of women that squirt, it's going to be that meets the definition of urine, but it's different. This is urine that is produced during sexual activity that is highly dilute.
We just got a question from the live chat. Can an increase in temperature to the genitals cause an orgasm?
He wrote organism though.
Yeah, just warmth itself. I've never seen that and never heard a report of that. I know that when I was a kid, I tried masturbating with Vicks Vapor Rub, which does cause a warming effect. And then you know what's weird though? As soon as you and so it's an intense reaction, but do not do this, because when you complete the transaction, some switch goes off in your brain, and all of a sudden the pain fibers turn on, and it is like your genitals are literally on fire. So
boys, don't try this at home.
Yeah, do not try that at home. But I do.
We're going to transition to our next question, which we heard some studies that erectile dysfunction is on the rise.
Yeah, I'm not aware of that. Next question. No, so for real, you know what it is? It's stress.
Huh. That makes sense.
It is very difficult to think about intercourse when your life is being threatened, and our lives are kind of being threatened every day with this stupid virus. So think about that. If you go back to caveman times, if there's a saber-toothed tiger stalking you in your cave, the last thing you need to be doing is doing the dance of the two-back beast. With a saber-toothed tiger, could jump on you at any minute. So it's a survival thing to not for your libido to turn off during times of stress. And
that makes sense.
I had kind of like a Halloween themed question, since it's
okay,
a spooky season. What do you think would be like more likely to actually like biologically be able to exist? Vampires or zombies?
Well, it depends. So the problem I've always had with zombies is that they just go on forever. You know, I could see that something could possibly reanimate or control somebody's brain. For example, there's a parasite called toxoplasmosis, and when rats get toxoplasmosis and cats carry it, it makes them less afraid of rats. And what's the benefit of that? Yeah, the benefit of that is the toxoplasmosis gets to transmit itself to the cat. So it benefits the parasite. It does not benefit the host, because the host dies when the cat eats it.
And humans
right?
get this too, right? And that it makes them more, maybe not aggressive, but they take more risks. Like
right, that's right, that's right.
A motorcycle crashes, they find that these riders actually have it. Is that
true? It's really interesting that something like that could cause these behavioral changes. And there are other parasites that cause, like the ants or caterpillars or some crap to make themselves more available to, the predators that are after them, whatever it is. And then, but the benefit is always to the parasite. Right. Normally when you think of a symbiotic kind of relationship, there's either mutual benefit or there's benefit to the host. But in this case, it benefits the parasite. So if you will allow that zombies can't, once there's no chemical reactions going on in the body, they will just fall over and die. Zombies are more likely to be real. But as far as just somebody just being an asshole and drinking people's blood, well, heck, we have people like that.
Yeah. we got a question about the fungus that grows and controls ants. And I also heard of one that will actually be able to control a grasshopper and they'll drown themselves.
Yeah. And again, that's always going to benefit the parasite, not the host. So zombie ants. You just Google zombie ants. The zombie parasite takes over insects through mind control. You can see that. Okay, here we go. Zombie fungus enslaves only its favorite ant brains.
What?
The parasitic fungus known to manipulate the brains of ants I'm just reading this. It doesn't make slave-like zombies out of any old host. It's somehow able to recognize the brains of different ant species and releases its mind-controlling chemical cocktail only when its preferred host. That's really interesting.
Yeah, that's scary. This shit terrifies me because there's a million different fucking parasites and weird.
Yeah, I know.
Your body, and you don't even
No, we only know what our brains tell us. That's the thing. And if our brain is telling us to go present ourselves to a predator, and that would be cool, and then the predator eats us and gets it and then passes it on to the next thing, then yeah, we're not in complete control.
There's also that disease that a lot of people are getting more and more wary of because it might jump, or I think it's called. We actually talked about this last time. The wasting deer disease, the zombie, and I've actually seen a moose who I think has this before.
Wow.
You know what I'm referring to?
Not at all. Sorry. If you ask me about these things ahead of time, I can become an expert in 5 minutes. But yeah, I don't know. But it is crazy. You know, we tend to think that we are.
You should check it out. Chronic wasting disease.
Oh, chronic wasting disease? Yeah. Now that I might know what that is. Wait a minute.
It affects the deer's brain.
Yeah, it's like a neurological disease in the deer, like elk and moose.
Is it a prion disease? Do you know?
Not
Okay, so prions are proteins that preceded RNA and DNA, and they are self-replicating effing proteins, and they will cause a thing called Creutzfeldt-Jakob disease or Kuru, and it also causes mad cow disease.
It says they think it's a misfolded prion.
Yeah, there you go. Chronic wasting disease, prion disease. Yeah, deer, elk, reindeer, silka deer, and moose. Yeah, it's so those are things you don't want to be eating those, because then it may turn, those prions may get in your system and you can't kill the damn things. And they can cause this disease called Creutzfeldt-Jakob disease in humans, and it causes basically the same disease in people.
Would you rather have Jacob's disease or fetal alcohol syndrome?
Oh, I would definitely fetal alcohol syndrome. At least I'd be alive. Oh, it says here there have been no reported cases of chronic wasting disease infections in people, so that's good.
They're worried it might jump to humans.
Yeah, we should always be worried about that. It's stupid animals with their diseases.
They lick their buttholes and shit. So what do you expect?
That's right. Filled with bacteria and parasites and penile cancer risk.
Penile cancer scares me, but I wanted to bring the conversation back to sex, because that's what most people ask about when they call in on your show, right? Just questions they're too afraid to ask their doctor.
Originally, when we did our first show back in 2005, they had 12 lines at Opie and Anthony's studio, and all 12 were completely filled. People were getting busy signals, and it was 100% questions below the belt.
Yep. That's awesome.
Now that we've answered most of those questions multiple times, we get more stuff. You know, I'm just looking at my.
Make your penis bigger. I feel like that's something that everyone Googles at some point. Is
yes.
It possible?
Well, yeah, there's a couple of things you can do. There's a suspensor ligament that
write this down, everyone.
Suspensor ligament. And what that does is when you get an erection, it makes it point up to the ceiling, right?
Yeah.
So if you go in and cut that suspensor ligament, you'll gain about a half an inch to an inch of length, because it'll kind of bloop out, right? But then it will never point to the ceiling again. It will always point to the floor.
Really?
Yep.
Okay, I wouldn't
Yeah,
want
it
to do
doesn't
that.
seem worth it.
The
Yeah.
best way to do it, and you guys, I'm looking at you on cam, so this won't help you, but the best way to gain penile length is to lose weight. So Dr. Steve's rule is for every 35 pounds of weight loss, you'll regain about an inch of penile length.
No way.
Wow.
Yeah. Yep, absolutely. Now that it's only linear for a certain range, right? If you weigh 900 pounds and you're dealing with a negative penile length. So you've got to, this is within a certain range of people.
Wait. So you're saying,
wait, back up a second. Do
That's crazy.
horse legs also have suspensory ligaments?
horse leg?
Yeah, a horse peni, you mean?
No, a horse leg, like an actual leg. Like
Oh yeah, probably. I'm not a veterinarian, but
Wait, I want to go back.
but look at suspensor ligament of the penis. That's if you're Googling stuff.
So, Dr. Steve.
Yep.
Literally every 35 pounds you lose, you gain an inch on your penis.
Yes.
So if I was to lose 35 pounds.
Not you though. See, the thing is, okay, so like I said, it's only linear for a certain range of obese people, right? So like if you're at your ideal body weight and then you lose 70 pounds, you're just going to look like a skeleton, a walking skeleton with this big droopy penis, right? But you're not going to actually gain 2 inches at that point. This is for obese people.
I lost weight, you're saying.
Yeah. I'm looking at you. You look like you're pretty close to your ideal body weight.
Yeah. I mean, most of it is beer weight. But so that's really fascinating, though. So if anyone's overweight, they want to get a bigger penis, they just got to lose weight.
Absolutely. And it's always been there. It's just been covered up with that pubic fat pad.
And is it because you have better circulation? Isn't that enough
No,
to make your
it's because of loss of fat.
Oh, okay. So
now there was another study that showed that people who take chronic sildenafil, which is the active ingredient in Viagra, they will gain about 1/4 of an inch. And there are other studies, and that's not worth it. And there's another study that looked at people that this was the craziest one. There's this device where you, I wish I was on cam now and I could kind of show you, but it's you take this Velcro ring and you put it around the head of the penis, and then you put another one around the base. And then there are these expandable bolts that go between the two. And then every day you can increase the tension on that and you're stretching out the penis. And when you do that, it's usually successful, but again, another 1/4 inch, it's not worth it. So, what women want, by the way, and I've had lots of women on this show talking about it, they don't care so much about length. They care about girth, if they care about anything. What's that? What are you showing? Yes. But then put 2 bolts between those rings and then make them so that you can make them, the distance between them longer.
Wait, so
using
go back to what women care about. They care about girth and what?
Girth and technique. The
motion of the ocean.
The motion of the ocean, that you're with them, that you're not somewhere else, because that's the worst thing that women tell me is that if you're just kind of looking off into space and just pumping away and grunting and stuff, that's not cool for them. They want you to be with them in the same room with them and interacting with them, and too, if you've been with somebody that you actually dig and you care about them, that there's nothing better than that moment when you become kind of one person,
Yeah, 100%. Actually, my mom, this is funny. My mom bought my brothers and I this 50-hour course on how to give women orgasms. She said, "This is a gift to your future wife." And it's a really funny course. It's called Can You Play? And it's all about number one thing is connection and being present.
Yeah.
But
we should be present anyway.
Eat girls. There's a whole section on face sitting.
The Wall Street Bitch's mom also does therapeutical ayahuasca.
She does.
Oh, that? Well, that's something I'd like to try.
I'm not allowed to talk about that.
I would like to try ayahuasca someday, but I'm just not into the whole, you have to shit your guts out for an hour before it kicks in.
So is it safe to say there's really no way to get a bigger dick unless you're overweight and you want to lose some weight?
No, I'm not really saying that. There are a couple of things that can be done. As far as your girth is concerned, these fillers that they use to put in women's lips, there are some people that will inject those around circumferentially around the penis to make sort of a built-in French tickler kind of thing.
Does that affect sensation at all, though?
It really, they're putting it under the skin between the sheath and the skin, so it shouldn't affect sensation to any degree. It's certainly not as much as a condom would.
Right.
Right. And I don't have a problem, with a condom. Well, back when I was using condoms, because I'm married now, and you know how that is. The one benefit is you can throw your condoms away. The downsides are innumerable, but that's the one upside. Oh, thank God my wife doesn't listen to your show. But anyway, she knows I'm just kidding.
Yeah. I used a condom last night. It was not as good. It's the first time in years.
Yeah.
Yeah.
Well, it's the thing about condoms is, first, don't buy a cheap condom. And think about all of the heartache that you're avoiding by wearing the condom, particularly if you're, having sex with somebody you don't know very well. So,
yeah, it's worth it.
Yeah, definitely worth it. And for people who have premature ejaculation, condom's a great choice.
That's true.
Yeah.
That's true. All right. Well, do we have any more? Dr. Steve, I
Yeah,
know
we
you had a hard
you had
stop.
limited time. We kind of fucked up the timing. So.
That's all right. No, this is fun.
All right. Good. Yeah, we'll move on. What's another question that we got, Hans?
We have one more
Where's
question.
Where's that list?
I
I guess
answered them
while we're
all.
looking for the list, why are some women unable to have orgasms?
So anorgasmia is a condition that there are a lot of women that have. Sometimes it's psychological. I knew someone once that was forced to get a tubal ligation when she was young, and she could never have an orgasm later. And we kind of figured out through analysis that the reason she couldn't have an orgasm was because she knew she couldn't get pregnant, and there was a part of her brain that said, what's the use? And once she realized that, she was able to have orgasms after that.
Really?
So yeah, there are sex therapists that can help with that. And, lack of orgasm is different than lack of libido. And those are two separate problems. Sometimes they go together, though, because if you've never had an orgasm in your life, you may end up losing your libido, because it's like, what's the point of this? It's just some guy grunting on top of me. It's gross, if you're not getting that other benefit out of it. So now I have a lot of women that tell me too that they don't care if they don't orgasm. They just enjoy the experience. So everyone's different. That's the thing. So if it's affecting your enjoyment, then you should seek help. If it's not affecting your enjoyment, there's nothing wrong with you.
Yeah, that makes sense. Interesting. Well, that's always been a mystery to me.
Well, the whole thing's a mystery, bro.
Yeah.
And the thing about sex is we do forget sometimes why sex was invented in the first place, because we tend to think of it as just something fun to do that carries with it some emotional, requirements, plus it's a little bit of danger. But really, it was designed for us to advance the species, but most of the time we're doing it. That's not what we're up to.
Are we the only species that has sex for pleasure? I'm sure there's
bonobos.
It's a bonobo.
Bonobos do, yeah. I don't know. Yeah,
No.
they're one of our closest cousins, so it certainly makes sense.
The bonobos have sex for pleasure.
Good for them.
Yeah.
I mean, what else is there to do?
Yeah.
I can at least play League of Legends if I can't get any,
League of Legends.
I don't know what that is.
Oh, I assumed you guys knew what that was. It's a game. Don't worry about it.
Well, Dr. Steve, I think we ran through all of our
questions.
listener questions. I guess we usually focus on medical topics, but I guess quickly I'd like to ask, what do you think the state of the union is and where we're going from here? Are we going to be okay?
Oh yeah, we'll be okay. That's, we're going to be okay. I'm just praying that the economy doesn't tank, because I'm getting ready to I'm a lot older than you guys, and I'm getting ready to retire in 3 years. And I just want to keep my 401k intact enough so that I can retire in 3 years. And by the way, when I do retire, a lot of the reticence I have to talk about certain things is, by God, going to go away. And I've got a lot of shit to say. Awesome. And so 3 years from now, Weird Medicine is going to be a totally different show.
The baptized machine still exists.
So you're gonna, you're going to keep your podcast. Hopefully.
Oh, of course. Yeah, I'll do that till I die.
Good. And do you want to shout out your podcast and your radio show for our listeners?
Sure. You could go to drsteve.com is one place to start. The podcasts are always there, or iTunes, Stitcher, any place where you listen to podcasts. And then check us out on SiriusXM. Channel 103 Saturday nights at 8 p.m. Eastern time, or 5 p.m. on Sundays Eastern time as well. And the best way to listen to it on SiriusXM is on demand. And everybody has an online account now, and that's the best way to listen to SiriusXM anyway.
Awesome. Yeah, Hans, actually, we just got Sirius. Well, we had it for free because he got a new car. We just got it just to listen to your show. So. Oh God! Well, that's awesome. Thank you. Yeah. Well, I need to give you guys a shout out too. So send me something you want me to plug, and I'll plug the hell out of it. That would be awesome. Yeah, we'd really appreciate that. Yeah, that'd be awesome. Your email. Cool. All right, Steve, I don't want to keep you any longer.
We took more than 45 minutes, but we appreciate your time.
Oh, it's fine. It's fine. Well, I said 45, so we'd get out in an hour and 15.
Yeah, that makes sense.
Because whenever we talk, I always, we go long because I actually do enjoy talking to you guys. You've got inquisitive minds, and that's fun.
We love having you on, and I love how we can just bounce around to the weirdest fucking topics.
Yeah.
But yeah, we always love it, and we appreciate your time, guys.
Let me ask you something though. Do you guys have virtual reality helmets?
No, his brother does.
What the hell?
Yeah, my older brother does. It's pretty wild.
What does he have?
He has I don't know. My mom got it for him for Christmas, and then he's like, "Fuck you, mom! Now I have to buy a brand new computer to use this."
Oh, so his has to go with the computer. Okay. What I was going to throw out to you is, obviously, you guys, if you don't imbibe, you're interested in imbibing in mind-altering substances. I want you to check out an app called Trip, TRIPP, and you can go to tripp.com. But if you have an Oculus Rift or a Quest or a Go, you can do it. And it is the most insane experience you'll ever have. Really? And it's it's a meditation app, but it's a 3D environment that changes every day. And they walk you through a bunch of breathing exercises. So it sounds kind of hippy dippy, but it's incredible. If you have a stress level of 10, it'll be a 2 when you get done. And it's 8 minutes, and it's really trippy because you have this environment. It's an alien environment. And then you rise up to the next level, and you do your next, you do your next breathing exercise. And the last one, you're just hovering over the earth. And of course they're saying, look at this, there's no boundaries. It's just, it's an incredible experience. And it's just like doing drugs if I had ever done drugs, which of course I don't know what that would be, but anyway, it's really neat.
That sounds awesome. I feel like I need to buy that just for that, because that's right up my alley. And
it's worth buying an Oculus Quest just for that.
And I've used it a couple times, and it's so mind blowing. I'm really excited for the future with this shit, because it tricks all of your senses.
Yes.
You really feel like you're in a different world, and it's just fucking insane.
A fun thing to do is do a free app called Richie's Plank Experience. And you get in and you go on an elevator and you go up to the, 150th floor. and then the elevator opens up and there's just a 2x4, or maybe it's a 2x6 hanging out over with a donut at the end of it. And you have to walk out onto the plank. And of course, you see the street below you to pick up the donut, and you can't do it, even though you know you're in your living room.
Really?
Oh, it's amazing. Yeah. There are reaction videos where they take video, and that's the fun thing, is to videotape your friends trying to do this, and look how stupid they look when they're walking across your living room, and they're, you know, whoa, and they're getting, you know, they're gonna fall. It's awesome.
That's hilarious. Yeah, we got to try that. The haunted house ones are really scary.
Drives me crazy. I can't do those. I can't do the zombie ones. Shit coming up behind me and scrabbling at my back and making noises and stuff. I can't do it.
It's going to get more and more real in the future.
Yeah.
Like interactive, and I can't wait. It's gonna be
Oh yeah, when you get the haptic suit and you can actually feel the stuff, and then of course the first thing that they'll do is do porn.
Yeah.
Any new technology, porn.
Yeah. I want to try watching porn on one of those. I feel like it'd be a totally different experience. But
It's awesome. Oh well, I mean, I hear it's awesome.
It's awesome. Kind of robot that you fuck with the thing on. And
They have that too. That's coming. But yeah, virtual reality is something I'm really interested in. And the Trip app, I've used it clinically in my office.
Oh, really?
Yeah, because I work at a cancer center, and we have a lot of people who have a lot of anxiety, and we've used it there to quell their anxiety before they go to chemo or something like that. And it's unbelievably effective. And I use the Trip app for that.
Awesome.
And it's astounding the effect that it had. I even had well, I can't talk too much about it, but somebody who was really anti-technology who tried it and said, "Where can I go buy one of these?"
Oh, wow. Wow. Yeah.
So,
Damn, you do like everything under the sun.
well, I'm old. I've had lots of time to do lots of things.
Yeah.
Very true.
Well, hopefully we can get there. We can get there one day.
Yeah, absolutely.
I'm not a doctor, but fulfilling life. Anyway, Dr. Steve, thank you very much for coming on. We don't want to take up more of your time, but
All right, boys.
let's
Thanks,
set up
Dr.
another
Steve.
interview maybe sometime in the next couple months. And
Sure, whenever you want.
awesome. Yeah, until then,
Stay safe.
stay safe. Yeah.
All right, take care.
All right. Adios.